Hello, I'm here to teach you about the parotid gland. Para means around and otic ear. So parotid gland is present near the ear. It is situated in a space called as the parotid space. It is also called as parotid bed or the parotid mold. So let's see a case scenario. A 38-year-old female, she had a mandibular fracture following a road accident and she underwent a surgery. And post recovery, she had a very unique complaint. She started sweating and salivating at the sight of food. So, what could be the condition? It's called Frey's syndrome. The parotid space, where it is situated, above there is the tympanic plate, the temporomandibular joint. Below there is the posterior belly of digastric and stylohyoid. In the front, the posterior border of the ramus of the mandible is present, the medial and pterygoid muscle. So there you see the TM joint above marked by the green arrow and below the posterior belly of digastric and the stylohyoid muscles are there, and in the front the posterior border of the ramus of the mandible with the pterygoids is marked by the red arrow. So this is the parotid space where the parotid gland is situated. So you see the location of the parotid gland in an yellow round there. The parotid space behind the mastoid process and the sternomastoid muscle are there. Medially, the styloid apparatus is present. We'll come to the general features of the parotid gland. It is the largest of the salivary glands. As we know, the other sublingual, submandibular salivary glands are there, but the parotid gland is the largest of the salivary glands. It is of the inverted pyramid shape. So you can see here, it's an inverted pyramid. The apex is pointing below. Here you are seeing the apex, and the base is pointing above. It has got three surfaces. One is the lateral surface facing the cheek and the skin here, and also two other surfaces, anteromedial and posteromedial. Simply you can remember like it has got a lateral surface and like post meridian, anti meridian, you can remember it as AM and PM. The parotid gland has got capsules, the inner true capsule, which is a condensation of the gland tissue proper, and it also has got an outer false capsule derived from the investing layer of the deep cervical fascia. Now, the outer false capsule, the parotid sheath, it has got two layers. It has got two layers, and the superficial layer is thick. It is embedded with the mesenteric muscle, and above it is getting attached to the zygomatic arch. The deeper layer is thin and it is attached to the tympanic plate and the styloid process. From the styloid process to the angle of the mandible, there is a thickened stylomandibular ligament. Things can be asked in objective question. What are the presenting parts? Already we saw that the parotid gland has got an apex, it has got a base, it has got a lateral surface, otherwise it's also called the superficial surface. Apart from that, it has got two surfaces, the anteromedial surface and the posteromedial surface. It has got an anterior border and a posterior border. The apex, I already told you, it is directed below, and it overlaps the posterior belly of the digastric muscle, the cervical branch of the facial nerve, and then the two divisions of the retromandibular vein, they emerge from the apex. So, regarding the base, it is directed above and related to the external acoustic meatus, posterior surface of the TM joint. The superficial temporal vessels, auriculotemporal nerve, and the temporal branch of the facial nerve all emerge from the base of the parotid gland. Remember, the base is directed above. Now, the superficial surface of the lateral surface is the largest surface covered by skin, superficial fascia along with platysma. Platysma is a thin sheet of muscle in the face. Then the parotidomasseteric fascia, that's a capsule. Over the superficial fascia, the branches of greater auricular nerve, the pre-parotid lymph nodes are present. So these are all in the lateral surface of the parotid gland. The anteromedial surface is related to the posterior border of the ramus of the mandible, and it is sandwiched between masseter and the medial pterygoid muscle. So it is between the two muscles there in the anteromedial surface. Coming to the posteromedial surface, the mastoid process with the sternomastoid, the posterior belly of digastric are there. The external carotid artery, it grooves the surface and enters the gland. The facial nerve enters the gland, piercing through the upper surface of this aspect. Okay. So these are all the relations of the posteromedial surface of parotid gland. Coming to the anterior border, it separates the anteromedial and the lateral surfaces. The structures emerging from above downwards in the anterior border are the zygomatic branch of the facial nerve, the transverse facial artery, the upper buccal branch of the facial nerve, the parotid duct, about which we will see later, the lower buccal branch of the facial nerve, and the marginal mandibular branch of the facial nerve. So these are all the structures in the anterior border of the parotid gland. The various branches of the facial nerve, the transverse facial artery, and the parotid duct. These are all seen in the anterior border. We'll come to the posterior border. It separates the lateral and the posteromedial surfaces. It rests on sternomastoid muscle, posterior auricular branch vessels, and the nerve pass upwards beneath this border. Coming to the medial border, it separates the anteromedial and the posteromedial surfaces. Related to the styloid apparatus, the internal carotid artery is seen here, the internal jugular vein, and the last four cranial nerves are seen here, and the medial to styloid process. There are some extensions of the parotid gland called as the processes: the facial process, the pterygoid process, the glenoid process, the pre-styloid and post-styloid processes. These are all extensions of the gland. Structures within the parotid gland, this is important, can be asked as a short notes. They are the external carotid artery. It divides inside the gland into the two terminal branches, the superficial temporal and the maxillary arteries. The level of termination is the neck of the mandible. It can be asked in the objective question. Now, this is the artery which is giving the branches, superficial temporal and the maxillary. The transverse facial artery is also a branch of this artery. Now, the retromandibular vein is seen in the parotid gland. It's formed by the union of superficial temporal and the maxillary veins. It divides into anterior and posterior division. The anterior division joins the anterior facial vein to form the common facial vein. The posterior division joins with the posterior auricular vein to form the external jugular vein. This you would have seen when you studied the face, the common facial vein, and how it gets connected with the deep area, the dangerous area of the face, all you have studied in face. Now coming to the facial nerve, it emerges through the stylomastoid foramen, that is the point of exit from the skull. So it comes out through the stylomastoid foramen, it enters the gland through the posteromedial surface and divides into two divisions, the temporofacial division and the cervicofacial division. From the temporofacial division, two branches are there, temporal and zygomatic. From the cervicofacial division, the buccal branch, marginal mandibular and cervical. The other three branches are coming from the cervicofacial division. So here you see the division of the facial nerve within the parotid gland, and it gives the appearance of pes anserinus, like the webbed fingers of a bird. That's called as pes anserinus. Now we are seeing the parotid duct, also called as Tenson's duct. It's 5 centimeters long, thick walled, emerges from the anterior border of the gland, and it runs forwards on the masseter muscle, turns medially, and its anterior border pierces few structures. It can be asked in your spotters, the buccal pad of fat, buccopharyngeal membrane, buccinator muscle. It enters the oral cavity, runs a short course there between buccinator and the mucous membrane of the mouth. It opens into the vestibule of the mouth opposite to upper second molar tooth. This also is a sub question for the parotid duct in spotters. Coming to the blood supply, the parotid gland is supplied by external carotid artery and drained by external jugular vein. The lymph nodes are the parotid nodes to the upper deep cervical jugulodigastric nodes. It is the lymphatic drainage for the parotid gland. Coming to the innervation, we've got somatic efferent fibers, general visceral efferent fibers, the autonomic fibers also are there. Now we'll just go to the secretomotor pathway. The secretomotor pathway for the parotid gland starts from the inferior salivatory nucleus, and from there the fibers are carried through the tympanic branch of the ninth nerve and the tympanic plexus of the ninth nerve through the lesser petrosal nerve. It reaches the otic ganglion. The relay happens here, and the postganglionic fibers are supplied through the auriculotemporal nerve. The control for the parotid gland is inferior salivatory nucleus. For the submandibular gland, it is the superior salivatory nucleus. When you study submandibular gland, you will be taught about SSS, superior salivatory gland, submandibular superior salivatory nucleus, submandibular salivary gland, and seventh nerve. Here for the parotid gland, it is inferior salivatory nucleus and the ninth nerve, which is connected with the secretomotor pathway. So there you see the ganglion and the relay through the auriculotemporal nerve. Now, the general sensations from the parotid are carried through the auriculotemporal nerve. The sensations from parotid fascia through the greater auricular nerve. The sympathetic nerves are from the superior cervical ganglion. They decrease the salivation in the acinar cells. Now, coming to the applied anatomy, infections of the parotid gland is common, called as the mumps, the viral infection, the parotid abscess. When the bacterial infection happens, there are some pus formation in the parotid gland. Then the tumors of the parotid gland are also common, also in the duct. We can investigate through the cyelogram or the cellography. Parotidectomy has to be careful because we saw that the facial nerve is going through the parotid gland. Very many branches are there, as many as 5 branches we saw, and these can be damaged during parotidectomy. So surgeon has to be extraordinarily be careful while operating upon the parotid gland. So parotidectomy has to be done very carefully. Then the Frey syndrome. Initially, what we saw in the first slide, when there is an operation, there can be a faulty regeneration of the auriculotemporal nerve, which can result in Frey syndrome, which is nothing but at the site of food, also with salivation, the person has got redness of the area around the skin, of the parotid gland or the parotid gland, and also there is some amount of sweating. This is the Fraze syndrome. Coelolithiasis is the stone in the parotid duct, and coelography is the procedure to visualize the duct by injecting the contrast through the vestibule of the opening in the vestibule of the mouth. And these are a few trial MCQ questions which you can try. And nowadays, the objective questions are very important because the all PG entrance, everything is based on the objective questions. So try to crack as many as questions as possible, which will be of help to you. And please go through the study material I have provided. And I wish you all the very best in your career. Thank you very much. And this is Professor Johnson talking about